Hello, my name is Semhar. This is Miss Sandra, my model. Today we're going to be talking about Botox and some off-label uses of Botox. Neuromodulators there's some brands, Botox, Dysport, Xeomin are some of the names that you might have heard about. Botox specifically has been around since the 1950s. It's been used for multiple medical purposes. In cosmetics, Botox, we've used it a lot in over 30 years. You can use it in the more traditional sense. Typically the glabella, forehead, and crow's feet are the most common areas that we treat on label, but there are other parts that you can treat. Those are off-label or non-traditional uses of Botox. So today we're gonna focus on those. The one that we're gonna do first is gonna be the brow lift. It's very simple, it's quick. You can use 2 to 4 units of Botox to just kind of lift the eyebrows. It helps open up the eyes, makes you look a little bit more awake, youthful, and people that have a little bit of drooping of the lids, they tend to benefit from that. It gives them a little bit of elevation of the lids. So we're going to start with that. I have already prepped my patient. She's clean and ready to go. So we just did 2 units on the lateral aspect of her brows. The next one we're going to be doing is the one on the nose. It's called the nasalis. A lot of people have a little bit of crinkling of the nose, and we end up having a horizontal line across our nose. So these are called bunny lines. So we're going to address those with 2 to 4 units of injections on both sides. So I'll have you make a crinkly nose. Perfect. Pretty simple.
Very easy.
How do you feel?
Great.
Okay. So the next one we're going to address is going to be the top part of the lip. It's called smoker's line or vertical lip line. It's very, very common. A lot of women have this concern as we age. Women tend to talk more and we form these vertical lines. People that tend to drink out of a straw a lot tend to form those lines. It's very simple to take care of. You just inject a little bit of Botox, about 4 to 8 units on the white borderline of the lip, and that takes care of it. I'll have you make a little pouchy face. Relax. The next one we're going to address is called lip flip. It's a very popular one on social media, Instagram. A lot of people, younger people, are very much into it. It's a simple procedure by injecting a little bit of 2 to 4 units of Botox on the femoral border. It helps flip the lip and almost makes you feel like you have your lips done without having to get lip fillers. It's very cheap, simple, so a lot of people like it.
One question we just received from a viewer is, how long does Botox above the lips typically last?
It's a good question. So typically when we're using it the traditional manner, Botox on the forehead or glabella lasts 3 to 4 months. But when you're using it around the lip or as a lip flip, it tends to last about 6 weeks, so it's shorter. Make a pout kiss. Relax.
I do it every day.
All right, she's a great
I
patient.
know, I never put water. It's really fun.
Hi guys. Hey, great job.
All right, the other one we're going to talk about is called the DAO. This muscle is it's a triangular muscle. It helps pull the corners of the mouth down. So it's a depressor muscle. A lot of women, as we age, you tend to see upside down smile, a little frown. It's from the DAO muscle. So make that E sound. So that's the muscle that's pulling it down. And it makes us look sad without intending to. So by just injecting the DAOA muscle, it can just flip the smile upside down. And then again, anywhere between 4 to 8 units per side, that will take care of the DOA. And this is a little illustrator. This is the muscle that we are addressing on the number 14. Okay, sad face.
Another question we just received is Botox typically painful?
It's typically not very painful. You can ask Sandra.
It's not painful.
We don't typically use numbing medication for this process.
The next question we received is how long does a typical Botox procedure last?
So typical Botox procedure can last anywhere. The procedure itself is a 5 to 10 minute procedure. Always it's advisable to have a little bit of a consult if you've never had Botox before. Just kind of have an understanding of how many units you're going to need, what area you're going to want to address. But the process of it is a 10-minute procedure. But the Botox itself lasts 3 to 4 months. The last part that I want to address, we're not going to do it on her today, but it's the TMJ or the masseter muscle. It's very popular. Women use it to slim down the face, or people that have grinding of the teeth. This big muscle right here, if you bite down, it's very easy to locate. We tend to have a little bit of bulging of that muscle from overusing it. By putting in about 20 to 25 units of Botox on each side of the masseters, it helps slims the face down. So it's a popular use of Botox or neuromodulators for that reason. Good.
And next question is how long after my treatment will I begin seeing results?
Great question. So typically I tell my patients to give it about 10 to 14 days to see full effects of it. If we feel like we need to add a little bit more units, we would ask the patients to come back in about 14 days, but typically 10 to 14 days is on average.